Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome back Joyce Griggs, patient advocate, and Alan Feren, patient advocate and otolaryngologist. Today's Kevin MD article is Why Health Self-Advocacy is an Essential Life Skill. Joyce and Alan, welcome back to the show.
Thanks again for having us. We appreciate the opportunity.
Yeah,
All right.
thanks so much.
All right, so let's jump right into the article. Joyce, for those who didn't get a chance to read it, what's this one about?
Well, so what we talk about in this article is that, we talk about financial literacy and, planning our careers is like, these are important life skills.
Mhm.
Well, what about our health, right? This is the greatest asset that we have. And yet we don't have a set of skills that we all learn to help us to be the very best advocates we can be for our health care. And so what we decided was that not only is it an essential life skill, but it's also something that needs to be condition or situation agnostic, because there are materials out there in the ecosystem as it relates to this topic, but it's a fragmented group of materials, and some of them are very specific to certain disease states and so on and so forth, which is amazing. However, if you're out there still searching for a diagnosis, you're among some of the most vulnerable. And where do you go if you need to find this information? So we talk about sort of a universal, comprehensive hub of information that's condition and situation agnostic that all of us really, need to be paying attention to.
Yeah, and Joyce, it's important, of course, for us to be health self-advocates. For those who didn't listen to our first podcast together, just give us some of the reasons why, and especially in our healthcare system, why it's important for patients to advocate on behalf of themselves.
Absolutely. So one of the things that I like to say is that, I found myself, I was an expert navigator of the system, but I was not an expert advocate for myself. And there's a difference between navigating and advocating. And what I realized was at the heart of advocating is that I and we are all each the leaders and the co-partners in our healthcare. And so I always looked at the healthcare professional, my doctor, my nurse practitioner, as the leader. And it doesn't quite work that way. And if you have to coordinate care, I mean, even those of us who have routine care, we're seeing dentists, dermatologists, women, OBGYNs, primary care physicians. So it's extremely important to be able to pull all of these things together for ourselves. And this is what becomes essential, because when we are partners in our care, there are data that show that there are better outcomes, get better health care. And what we don't realize is because we're afraid maybe, I'm being confrontational with my
Hmm.
doctor or nurse practitioner. At the end of the day, doctors and nurse practitioners want engaged patients, because then they realize, okay, it's not so much what happens inside the visit, it's what happens outside of the visit that really is what impacts our care and our health at the end of the day.
So, Joyce, we're going to, of course, talk about some of those tips and ways we can become better self-advocates. But I want to ask Alan this question because, obviously, as an otolaryngologist and a patient advocate, so you've seen both perspectives. So, talk a little bit more about the evolution of the doctor-patient relationship. As Joyce said, it used to be the physician would be the leader, and the patient would follow essentially what the physician says. But that relationship has evolved through the years, right?
It has, Kevin, and basically it's based upon many chapters in my personal life, beginning to help my parents when I was in medical school, and then from the classroom to the operating room to the recovery room to the emergency room, and then me as a patient, either performing surgery or having surgery performed on myself. And I learned through that experience working with my patients and my parents' physicians how to collaborate. I think the collaboration is really important. So when we talk about self-advocacy, it's really calm assertiveness. It's not adversarial. And what I saw over the years of my practice was that patients who were empowered became activated. And when they become activated, they become engaged in the care themselves and partner with you. So that's really the evolution of the partnership. However, I think the bottom line is the best medicine isn't what happens to you, it's what happens with you.
Mm-hmm. And Alan, tell us
Mhm.
about how, when patients are activated, how can that improve their care at the end? Do you have a story or a case study perhaps you could share with us?
Yes, I think when I first started my practice, because it was just shortly after the Dark Ages and the stagecoaches, I wrote all my own patient information. And I knew what was going to happen on day one, day two, day three, postoperatively, because my practice was primarily surgical in nature. And patients would come back to me and say, gee, Dr. Feren, everything you said happened just like you said it was going to happen. And I thought that that was an interesting experience that I had personally. Another situation that was fairly comical, actually, was that patients would be handed a stack of information and that I had written. And they said, gee, do you expect me to read all this? And I said, yes, I do expect you to read all this because this is going to be your story, both preoperatively and postoperatively. So prepared patients
Mhm.
are going to do better. And we know as physicians, and I'm sure it's your experience as well, that it makes all of the time that you spend with them much more efficient. If you come in as a patient who is organized, empowered, and willing to partner with your physician, you're going to have the best outcomes, or the outcomes will be as close to optimal as possible.
Joyce, the article talks
Mhm.
about health self-advocacy as an essential life skill. So, what is your approach to mastering some of these concepts?
Mhm. Well, there are 8 concepts, right, that we say are part of health self-advocacy. And we don't say, come in and learn all 8 of them. We say, come in and take what you need and then develop as you go. Because, I was at a conference recently and it was an industry conference and there was a lot of talk around health literacy and the
Hmm.
importance of health literacy, which is an important piece of health self-advocacy. But I think the first thing is what we spoke about is mindset. My mindset now is like, wait, I am a leader and a co-partner with my providers in my care. Yes, I need health literacy, and then I have to make sure that I understand these concepts and can put them in my own language. And that it's also about learning, as Alan was saying, it's a certain sort of assertiveness that I have to know myself. Maybe I'm not an assertive person. We talked about this last time. If I'm not assertive, then maybe I need to write my questions and hand them to my doctor or send them in advance to my nurse practitioner so that I don't have to be the one asking these questions, but that it's important to not just head nod, but to really know that you understand what it is that they're asking you to do. So it becomes asking for clarity. And then, of course, we talk about things like knowing your family history
Hmm.
and your personal health history. And these are things that are critically important and that not everyone has a good handle on what's our personal health history and what's the family history, because that may impact you as you go further in your life as you grow older. Things change, and then you say, oh yeah, and then, oh, remember Aunt Clara, she had
Hmm.
whatever it was, type 2 diabetes, for example, later in life, something along those lines. So it's also, of course, the financial aspects of care. It's important in the US. These are things that we have to deal with. And also building the care team, knowing we have a whole list of tools on how to interview a healthcare professional, because even if you don't have choice, because some of us don't, you still want to know who that person is,
Hmm.
because you're going to be in a relationship. And I think that's the thing that's most important to understand as we sit as advocates for ourselves. And really, when we get overwhelmed, to say, you know what, I'm a little overwhelmed right now. Can you please just repeat that? So these are all the things that we talk about in terms of what it takes.
So, Joyce, I know that it's like a whole program, and there's 8 pillars, as you said. So, for those who just want some takeaway messages, and
Mm-hmm.
certainly we could certainly direct them to your resources, what are some, say, the top 3 things that patients should know about that would have the highest impact or yield for them to become better self-advocates?
Hmm. Yeah. I think the number one thing that I say is be prepared for your visits.
Yeah.
So look at the visit as something that you don't just go to and wing it. You actually take some time in advance of the visit to figure out what are the two things, maybe three things that are most important to you in that visit, and bring and open the visit with, these are the two things that are most important to me that I would like for us to cover today, to have clarity on that, to learn how to use, if it's available in the practice that you're in, the portal, and understand what's in that portal and how you can access that material and how you can communicate with your healthcare providers in between visits. And then the third thing that I like to say, these are like sort of the really top things as it relates to the visit, is when it comes to Dr. Google or Dr. ChatGPT now in everybody's lives, to really be mindful of where that information is coming from that you're finding on the internet or via the ChatGPT, which often does not give you the quote unquote references. So that you want to make sure that you're using really credible references when you are getting information from the internet, and if you're using ChatGPT or another one of these, AI models, it's really important to ask it to give you less. Give me the top three things and then tell me, where did you get this information, so that I make sure that you're using credible sources. So those would be my tips.
So that actually led me to the question I was going to ask specifically about AI. I read in the New York Times a lot of patients are simply uploading their medical record to ChatGPT and other AI large language models. You mentioned that sometimes the information that they give back isn't reliable. So, Joyce, have you heard of a case where sometimes a recommendation made by AI led a patient astray, perhaps, or gave a patient misinformation when it comes to their
Mhm.
health?
Mhm. I don't have a specific case of this, but what I will say is that we know that, number one, they hallucinate. So
Mhm.
these AI models hallucinate and sometimes make things up. And that the best thing, and that all of the experience that I've heard from experts, from either patient advocacy organizations or doctors or other healthcare professionals, is if you're loading your information into this and asking it a question, you again have to make sure that you ask it what sources is that
Mhm.
it is using, because otherwise you could get into trouble. And never take it as, now they've gotten smart, there's more protocols built into them now where they'll say this is not medical advice, you need to talk to your doctor. They will say that, very expressly. And I think that's the most important thing for people to remember. Do not use it as medical advice. Do not use it as 911. And, just go with caution.
Alan, when it comes to patients being self-advocates, there's a lot of friction points in our healthcare system, both from the patient standpoint and, of course, from the clinician standpoint as well. Sometimes I read in the physician forums, when patients do their own research and go to ChatGPT or Google, it's often framed in a pejorative framework, right? So tell us about some of the friction points our healthcare system has that makes it more difficult that for patients to become self-advocates today, and how can we overcome some of those obstacles?
First, I'd like to go back to something that Joyce spoke about, which was the hallucination. I personally have experienced problems in my writings where sources have been cited, but I go and personally check the sources. It's not enough to know that
Mhm.
such and such a source was used. And they may even quote that source incorrectly.
Yeah.
Mhm.
For example, one of the things that I was looking at was how much time how much time physicians actually spend with patients. And ChatGPT gave me an answer of 47% of the time, which is really not true. So it's important to really check those sources yourself. If you're
Mhm.
not a clinician, sometimes it's hard to kind of disarticulate all the information that's in there. But if there's something that looks askew to you, don't use that source. In terms
Mhm.
of friction points, I think it's going to take time now for physicians to begin to accept the fact that patients are becoming more and more engaged in their care. So it's going to be a give and take between physicians understanding the patient's needs and the patient's being that calm assertiveness that I
Mhm.
spoke about. The take home message really is that better decisions and fewer errors and stronger relationships are built when there's this partnership. Empowered patients have improved outcomes, and this rebuilds trust in the system. So you need to have this full participation on both sides, an equal 50-50 with that responsibility, which I mentioned in our first article together.
Mhm.
We're talking to Alan Feren and Joyce Griggs. Alan is an otolaryngologist and patient advocate. Joyce is a patient advocate. Today's Kevin MD article is why health self-advocacy is an essential life skill. Now we're going to end with asking you, each of you, just to share some take-home messages. Alan, why don't you go first?
Sure. I think the message that I would give, particularly to my clinician colleagues, is prepared patients benefit everyone. If we encourage them to come prepared, take notes, have an agenda, as Joyce had mentioned, bring a support person together, this improves safety. And it also brings back efficiency in the office. If you have 15 minutes and 5 minutes of that 15 minutes is chart work, basically, on the EMR, there's 10 minutes of time to cover 2, 3, 4 different issues that we have, particularly as we age. So the message really, the bottom line is advocacy strengthens and not slows care. It makes it much more efficient.
Mhm.
And Joyce, we'll end with you, your take-home messages.
I mean, my take-home message is always this. It's important to remember that we are the partners and the leaders in our care, and that I always say, assume nothing. Do not assume that your doctor is going to follow up with you. Do not assume that your nurse practitioner is going to ask you all the questions that you need to have that need to be asked. It's not, first of all, people are human. Second of all, the system is built for speed, not for connection. So it's not the faults of the clinicians and it's not the faults of the patients. It's just how it is. So it's really important to know that you need to be on top of these things.
Joyce and Alan, thank you so much for sharing your perspectives and insight. Thanks again for coming back on the show.
Thanks for having us.
Again, thank you, Kevin.